What could be the reasons for spotting after period, and how does it relate to pregnancy possibility?
Hey there, welcome to our video today. We'll be discussing an important topic that many people are curious about: spotting after a period and how it relates to the possibility of pregnancy. Let's dive in and explore the reasons behind spotting and what it could mean for pregnancy.
What is spotting and what are the common causes?
Spotting refers to light bleeding or discharge that occurs outside of the regular menstrual flow. It can appear as pink, brown, or even red spots on underwear or toilet paper. There are several potential reasons for spotting after a period. Let's take a look at some common causes. Hormonal fluctuations. Hormonal fluctuations can be one of the main reasons for spotting. During a normal menstrual cycle, estrogen levels rise and fall, and progesterone levels increase after ovulation. If these hormone levels are imbalanced or disrupted, it can lead to spotting. Birth control methods. Certain birth control methods, such as hormonal contraceptives or intrauterine devices, IUDs, may cause spotting as a side effect. This can happen during the initial months of use or throughout the entire duration of using these methods. Infections or sexually transmitted infections, STIs. Infections or STIs can sometimes cause spotting. Conditions such as bacterial vaginosis, yeast infections, or certain STIs like chlamydia or gonorrhea can lead to abnormal bleeding or spotting after a period. Uterine issues or polyps. Underlying uterine issues, such as polyps, small growths in the lining of the uterus, or endometriosis, a condition where the tissue lining the uterus grows outside of it, can cause spotting after a period. These conditions may result in irregular bleeding patterns.
Can spotting after a period indicate pregnancy?
Now let's address the question of whether spotting after a period indicates the possibility of pregnancy. It's important to note that spotting after a period is generally not a reliable indicator of pregnancy. Here's why. Implantation bleeding. Implantation bleeding is often mentioned as a possible cause of spotting during early pregnancy. It occurs when a fertilized egg attaches itself to the uterine lining, causing slight bleeding. However, implantation bleeding is not experienced by all pregnant individuals, and when it does occur, it usually happens around 6 to 12 days after conception, which is before the expected period. Menstrual irregularities. Spotting after a period can also be attributed to menstrual irregularities. Factors like stress, changes in weight, certain medications, or medical conditions can disrupt the regular menstrual cycle and lead to spotting or irregular bleeding. Confirming pregnancy. If you suspect you might be pregnant, the most accurate way to confirm it is through a pregnancy test. Home pregnancy tests are widely available and can detect pregnancy hormones in urine. For a more definitive confirmation, consulting a healthcare professional and undergoing a blood test or ultrasound is recommended. In conclusion, spotting after a period can have various causes, including hormonal fluctuations, birth control methods, infections, or uterine issues. While spotting after a period may be a symptom of pregnancy, it is not a reliable indicator on its own. If you suspect you might be pregnant, it's best to take a pregnancy test or consult with a healthcare professional for further evaluation. Remember, everyone's body is unique, and if you have concerns about your menstrual cycle or reproductive health, it's always a good idea to seek medical advice.